하나, 둘, 셋.
Hello. Easy and comfortable orthodontics learning over a cup of coffee with Ji Dae-kyung, Orthodontic Barista Senior.
And Lee Jungkook, Orthodontic Barista Jr.
In this session, we're going to learn about the orthodontic treatment to save the wisdom teeth. Before that, Ortho Barista's special time has started from now on, right?
Yes.
노래를 불러주시라고.
커피 한 잔에 이 노래
Shall we get a cup of coffee? Isn't the correct song? The only song I know. It's time for today's coffee, recommended by Ortho Barista. Let's open it.
짜잔.
Dalgona coffee sounds sweet and delicious. Since our topic today is wisdom teeth, it does have a bit of a connection.
Are we making it today?
What will we use to make it?
I've never really made it.
We'll give you some tools. Would you like to try rock, paper, scissors?
You'd better win, right?
네.
가위바위보, 가위바위보.
와. 야, 이게 진짜 형님
Is it fine with you? That's comfortable to use.
I can't do the lecture today. Are we seriously going to stir it 400 times? It's exhausting. I'm done. I'm in tears.
Machines can't beat humans.
사람 못 읽네요. 와, 이거 무슨 알지네.
This kind of feels like mixing alginate or maybe impression stone, doesn't it?
저도
되셨나요?
Dr. Lee Jungkook, isn't this just espresso?
It feels like milk and foam are just stuck together.
Would you like to try it? Oh, it's really delicious. If you try making this during your lunch break, it feels like the whole break might fly by.
날아갈 것 같네요. 오늘은 이제 사랑니 살려 쓰는
Now, let's talk about saving wisdom teeth. Let's start by reviewing a paper first.
가도록 하겠습니다.
Actually, I didn't show this to you beforehand, but I slipped it in along the way.
넣습니다. 자, 이
Now, if you look at this case, let me ask you a question. Do you have any idea about the CC?
예상이 되시나요? CC. 과연 뭐 때문에
CC is related to orthodontics.
좀 관련된 건데.
But with the step between number 27 and number 6, it might cause some discomfort during occlusion. Clinically, I think there might be some issues within that sense.
사실 이
In fact, this case is something I've never encountered before, and it's a very interesting case.
되게 좀 흥미로운 케이스입니다.
This patient was experiencing discomfort with a 3-unit bridge in the number 30s,
3유닛 브릿지가 좀 불편하다.
along with a possible odor. She came to me asking if the wisdom tooth, number 38, could somehow be saved.
38번을.
She already knew it was present.
네. 저 38번.
The patient came in specifically to address this issue.
이거를 주소로 내원을 하셨습니다.
Actually, I'm wondering if it's because of that situation whether the wisdom tooth will come out or not.
저 사랑니가 나와줄지.
I feel like I'm not yet able to make that kind of judgment.
저는 아직까지는 그런 판단을
Dr. G, in your opinion, do you think the wisdom tooth can actually come out?
가요.
It doesn't seem easy to me.
The patient suffered from discomfort and desired to redo the bridge.
이게 이제 너무 무리한
Rather than considering it an overly aggressive treatment, we decided to give it a try, knowing there are other options if it doesn't work out.
그래서 일단 시도를
So, we decided to proceed.
자,
The bridge was cut, and the pontic was removed. Number 37 was moved forward. This is the 4th month, and we are observing the progress of the movement. We proceeded with partial orthodontics, placing an indirect anchor in the premolar area and moving number 7 forward. A year later, we began to upright the wisdom tooth. It's possible the tooth had ankylosed, making it difficult to move as intended, no matter how much force was applied. Because the area was so confined, it might seem easy to lift it by attaching brackets, but in reality, the field was extremely narrow and challenging to work with. Nevertheless, after approximately 21 months, we managed to close the pontic space, move number 7 into that space, and upright the wisdom tooth in this case. If you look at the intraoral photos, the space was completely closed by the 7th month. After that, we continued to upright the wisdom tooth. There could be various methods for uprighting the tooth. We managed to upright the tooth and facilitate its eruption into the oral cavity. Although we couldn't be completely certain at first, once we observed movement, it seemed feasible to proceed. Of course, achieving 100% perfect alignment would have required more time, but the patient felt that the occlusion with the maxilla was reasonably acceptable. So, we concluded the treatment after approximately 21 months in this case. Looking back at this case, I wondered if, before doing the bridge considering number 36 was missing for about 10 years, exploring a treatment option that utilized the wisdom tooth might have been worthwhile at the time. However, rather than judging whether one approach is better or worse, it's more about understanding that orthodontically, this type of solution is also possible.
해볼 수 있구나. 그 정도로 좀 이해하시면 좋을 것 같습니다.
This case demonstrates a standard eruption process for wisdom teeth in either the maxilla or mandible. This is about how a wisdom tooth erupts when tooth number 7 is extracted. As you can see, in the case of the maxillary third molar, it maintains its angulation while uprighting during eruption. For the mandibular, it seems a bit different from what is commonly described in AJODO paper. You might have different opinions, but for the mandible, I initially thought there would be more mesial tipping during eruption.
Although the exact mechanisms of eruption are not fully understood, it feels like the tooth might tilt as it comes out.
However, as seen here, mandibular teeth generally maintain mesiodistal uprighting during eruption. That was the main conclusion of this topic. Today, I'll be sharing insights about wisdom teeth over the course of 2 discussions. First, I categorized the cases based on whether the wisdom tooth had erupted or not. Then, further divided them into 3 categories: whether root development had occurred, whether it hadn't, and cases where the root had developed but the tooth was significantly tilted. Based on this classification, I'll proceed with the case analysis. So, let's start with the first category, unerupted wisdom teeth with underdeveloped roots. Let's begin with unerupted wisdom teeth with underdeveloped roots.
The first case I'll show you is the most common type. The patient initially visits due to other malocclusion issues, including a crossbite. I'll skip over the specific details of the diagnosis and focus on the main case. If you look at number 46, a lesion was found at the root apex, and since the patient was still young, it was possible to save the tooth with endodontic treatment. However, there were other orthodontic concerns, so it was decided to extract the tooth while proceeding with the orthodontic treatment. After about 2 years, the treatment was successfully completed with the tooth being properly aligned. Other orthodontic issues were also resolved.
There might be some debate about this approach, but it worked well in this case. As an orthodontist, I've seen different treatment options based on specialties. For example, oral surgeons might lean towards extraction and implants, while specialists in restorative dentistry would prioritize endodontic treatment. Since I'm an orthodontist,
rather than focusing on what's better or worse, it's more about understanding that these are viable options depending on the situation. Moving on to the second and third cases, these are more interesting cases where we'll focus on root development in patient's age. This should give us a better perspective on how we approach treatment. This patient is 13 years old female patient, and look at her wisdom teeth. As you can see, the root development was quite advanced. This case dates back to around 2013, almost 10 years ago. At that time, there wasn't as much information available regarding wisdom teeth as we have now. The concern was whether number 38 and number 48 would erupt properly. This patient had a plan involving the extraction of the maxillary number 7. But there was uncertainty about whether number 8 would erupt as expected. Generally, there's the assumption that as the root develops, the pushing force will help the wisdom tooth erupt. So when we extracted the mandibular number 7, there was the concern about whether the wisdom tooth would emerge. Dr. G, what's your take on this?
Honestly, I was worried that the patient might be quite upset if it didn't work out. If the wisdom tooth didn't erupt, it could be due to ankylosis or other issues with number 37.
It was necessary to move the anterior teeth back, but extracting tooth 4 wasn't an option because number 47 wasn't in great condition. So, I started thinking about possibly of extraction. The progress is a little interesting. This is what it looks like 8 months or 9 months after number 7 extraction. I was a little surprised too because I paid close attention to the X-ray to see if it would turn out well or not. But it almost seemed like an over-concern, as it came out smoothly right away. I first noticed that it was developing quite well and coming out properly. So recently, I took another X-ray. The treatment was done back in 2013, and when I checked it again recently, I saw that the wisdom teeth were in really good condition. Now, let's move on to the next case. The next case involves a 17-year-old female patient who is 8 months in. Looking at the roots, particularly the lower jaw, number 38 and number 48 teeth are nearly fully developed, as she's almost an adult, but the root development was almost non-existent. For this patient, I thought to myself, this was a case where we extracted number 7, and since the root of number 8 hadn't fully formed yet, I thought it would likely come out well. However, when we look at the progress of this patient, this is the situation 1 year later. After 1 year, the root has developed, and she is already over 18. After about 2 years, most of the issues related to malocclusion were nearly resolved. By the 3rd year, we can observe a gradual eruption of the tooth. It took almost 4 years for the tooth to fully erupt. This experience made me reflect on the relationship between root development and eruption. While it might be a hasty generalization, I came to think that if the wisdom tooth root has developed to some extent at a relatively young age, there's a fair chance for eruption. On the other hand, if the root development is still incomplete in adulthood, the eruption process might be more challenging. What do you think?
While preparing for this, I started looking into studies related to tooth eruption. There's a paper published in the AO journal that discusses this, looking at the key points. It seems they arrived at 3 main conclusions. The focus was on whether there is a difference in root formation between the eruption group and the impaction group of wisdom teeth. They specifically studied this in a group of 15-year-old patients. In cases where the root was about 1/4 formed, it was observed that these teeth were 4 times more likely to be in the early eruption phase, even though they hadn't fully emerged yet, compared to those with less root formation. This suggests that delayed root formation increases the likelihood of impaction. While there aren't many studies on this topic, there are a few useful papers, and going through them has been an interesting process.
그런 것들을 확인하는 과정들이 조금 재밌는 과정인 것 같았습니다.
네, 아마
It seems like we can draw some parallels to the cases I showed earlier.
좀 시킬 수 있을 것 같네요.
The considerations regarding root development, age, and eruption are similar, and they could serve as helpful references when addressing wisdom tooth management.
좀 참고하시면 좀 도움이 좀 되실 것 같고요. 이 환자도
Now, this patient is a 22-year-old female.
어디 부분이 문제냐면은 저 20번대
Let's take a closer look at the number 20th and number 30th region to identify the specific issue. Looking at this 22-year-old female patient, the wisdom tooth roots are noticeably underdeveloped.
그러면 이제 어떤 생각이 드냐면은 분명히 저거는
This naturally leads to the thought that it likely won't erupt properly.
일단 이 환자도
So, for this patient, orthodontic treatment wasn't initiated specifically because of the wisdom teeth, but rather due to issues with the front teeth, which were addressed simultaneously.
하는 게 일반적일까요?
Typically, in such cases, the standard approach might involve intruding tooth 27 and placing an implant in the number 37.
That seems like the most appropriate solution.
물론 이제 저
Of course, for number 27, instead of intrusion, it's also quite common to perform root canal treatment followed by a crown.
네. 그래서 일단 하는 김에
So, during the orthodontic treatment, this case also turned out to be quite interesting. After about 6 months of intrusion, we focused on lifting the maxilla. Surprisingly, the wisdom tooth root, which hadn't grown at all even past the age of 20, suddenly started developing. This could be a coincidence, or perhaps it's related to the removal of some kind of stimulus. Maybe the pressure from number 27 was alleviated, allowing growth to occur. Dr. G, what's your take on this?
Textbook theories, like the concept of adult occlusal equilibration, suggest that eruption forces can increase once trauma or pressure is relieved. Perhaps this principle played a role here. After the pressure was removed, not only did the root grow significantly within 6 months, but some degree of eruption also occurred.
Initially, we had the option of extraction and implant placement if it didn't progress, but we decided to proceed with this approach. When managing impacted teeth in the posterior region, it seems more clinically practical to attach an appliance as early as possible, pull it forward to gain control over the crown, and then focus on uprighting, because it's hard to do route movement from there. It was so far in the corner, so I somehow erupted into the oral cavity, then uprighting to complete the treatment. This case took about 32 months to complete. And I'm sure other dentists might have their own opinions on how it should have been handled. I think it's better to view this as one of the possible approaches rather than the only way to handle it.
However, considering the significant amount of movement involved, weren't you concerned about the mobility of the tooth during the process? Was it okay?
Actually, since the wisdom tooth was embedded within the alveolar bone, it was okay in this case. However, when a tooth is already in the oral cavity, emerging well but pulling it in a parallel direction, there's always some concern about its stability. I'm sure there are also factors related to the TF.
Whether it's distalization, mesialization, or protraction in the posterior region, aligning the vertical angulation properly is crucial for stability. That seems to be the key. When I was practicing, I used loops quite a bit. It was a technique that worked well for precision and stability. Using TMA wires for such treatments probably wasn't a common approach. Even with the presence of teeth like number 6 and number 7, I don't think molar traction was often considered. Even when using T-loops or similar techniques, there were always forces that could cause the anterior teeth to move posteriorly, which is why scatter anchorage is considered one of the best in Korea.
When I was in training, mini implants were already a widely used technique. So it was hard to get exposed to older concepts like those.
You did make the Dalgona coffee with that machine, but it took you a bit longer.
It really makes you think that even the latest technology isn't always the best. The fourth case involved less advanced root development. But now I'll present cases where the roots are fully developed. and the wisdom teeth are somewhat standing within the alveolar bone.
잇몸뼈 내에서 어느 정도는 서 있는 사랑니와 관련된 그런 케이스를 좀 보여드릴게요.
I'll show you 4 cases.
젊은 환자분이신데
The first of a young patient with absorption on the distal side, number 47.
흡수가 있어서 환자분이 좀
The patient was in significant pain, and after trying root canal treatment, the problem persisted, leading to the decision to extract the tooth.
발치 결정이 좀 내렸죠. 또 환자입니다. 사실
Actually, the tooth was extracted, but I did have some doubts.
빼고 임플란트를
Should I extract it and place an implant, or should I try to save the wisdom tooth?
저 당시만 하더라도
At the time, I had just started my practice, and I was really worried about what I would do if I couldn't save it.
혹시 못 살리면 어떡하나. 이런
So, the patient was willing to wait and preferred not to have an implant, so we decided to try to save the wisdom tooth through orthodontics.
그래서 최대한 이제 교정으로 진행을 한
Partial orthodontics with indirect anchorage was used for traction of number 38.
인다이렉트 앵커를 하고 이제 38번을 이제 당기게 됐고요.
It actually came out quite well. The treatment took over a year, and it was done with a partial approach.
넘게 걸렸는데 저 이제 부분으로만 했고 저 사랑니가
When the wisdom tooth erupts, it usually comes in at an odd angle, which can make the adjustment really tricky.
여기 보시면은 저 구석에 있는
Here, as you can see, we barely managed to apply indirect anchorage for the tooth at the back.
와이어도
Since we couldn't attach the wire directly, I used resin to stabilize it, allowing only number 8 tooth to move.
이런 식으로
The buccal movement is quite pronounced during traction. Since the brackets were all placed buccally, managing the tendency for the tooth to move buccally was challenging.
이렇게
To control that, I had to stabilize with some lingual mechanics as well.
잡아주고
The mechanics were quite tricky.
좀 어려웠던 것 같습니다.
생각보다
Surprisingly, the protraction of number 8 moved at a fairly good pace over about 1 year and 1 month.
생각보다는 물론 이제 길게 걸렸지만 1년
Even though it took a while, the amount of movement was quite satisfying.
꽤잘 따라온 것 같아요.
Do you think this might be due to the inclusion of vertical components in the mechanics?
제 생각에는
My thought is that cases requiring a lot of uprighting tend to take longer.
케이스들이 좀 많이 걸리는 편이었던 것 같고 저렇게 조금
For cases where the tooth is already somewhat upright, it tends to follow along with the movement.
얘를 이 뒤뚱뒤뚱해서 오는
But the challenge is managing the instability and making sure the tooth doesn't move in unpredictable ways.
차이인데
There's also the factor of age to consider.
있을 것 같고요.
Still, for this case, with just a little over a year of treatment, I think it's quite manageable.
The diagnosis might not be easy, and the approach isn't straightforward. But looking at the case, it's truly remarkable.
케이스만 보면 너무 진짜 놀라운 케이스입니다, 진짜로.
The patient was very satisfied, so I felt quite proud.
했던 또 생각이 나네요. 그래서 이제
As for retention, I'm always uncertain about it. When the wisdom tooth is upright, there's a bit of a relaxed feeling. So I place a splint on the buccal side to keep it in place and continue monitoring it.
플린팅처럼 붙여놓고 계속 좀 체크해드리고 있습니다.
어찌됐든 뭐
Anyway, as we discussed previously, the horizontal movement in the posterior region is often influenced by vertical adjustments.
조절이
The vertical component seems to be a significant challenge.
TFO is something I worry about the most, and in fact, it can be the cause of failure in some cases.
그것 때문에 좀 실패하는 경우들이 있기 때문에 근데 일단은
But in the end, I'm not entirely sure about how to completely manage those aspects.
살짝 좀 다듬
Now, regarding enamel, we can sometimes refine it slightly, and with partial orthodontics, we can adjust things more precisely.
그렇지만은 그래도 이제
But if the mechanics are well managed, cases like wisdom tooth tend not to be problematic.
저런 케이스는 그렇게 문제가 되지는 않은 것 같습니다. 이번에 이제 상악
Next case is related to the maxilla, and while it's not a very common situation, it was treated with partial orthodontics.
진행을 했던 케이스입니다.
The patient initially came in for anterior tooth orthodontics, and after proceeding with partial orthodontics, we were able to successfully traction the wisdom tooth and avoid the originally planned implant in number 16. However, it did take quite a bit of time, and the follow-up was 2 years.
그리고 2년 팔로우업이었는데 따로 뭐
We didn't use additional retention wires, it was just maintained on its own.
그러면 그냥 잘 유지되고 있는 좀 상황이었습니다. 그래서 이렇게 이제 인다이렉트
Using indirect anchorage and always considering passive bracket bonding, wires, and other aspects is key.
부분들 좀 고려하고
When I start partial orthodontics, I always make sure to inform the patient that there may be occlusal issues, and I mention the possibility of full orthodontic treatment.
But when we look at panoramic x-rays, we always pay attention to the position of the sinus, even in cases like the number 4 or number 5 molars. Here, you can see that the sinus is a bit lower between number 6 and number 5 molars. While it hasn't reached pneumatization yet, it does seem to affect the inclination of the teeth. The tooth doesn't seem to follow the movement as easily because of that.
So, I try to move it to a point where it doesn't cause any occlusal issues with the lower jaw. If it tilts too much, there's definitely a risk of relapse. But so far, it's been functioning well without major problems. I'll show 2 more cases related to wisdom teeth, and then I'll wrap up. It's important to pay close attention to number 40s. Of course, it's also helpful to look at the number 20s, but here, let's focus on number 40s. In this patient, we moved number 47 forward, and interestingly, without even attaching a device to the wisdom tooth, it still tended to follow the movement. Let's take another look. We didn't attach a device to the wisdom tooth, just to number 7 molar. By slowly moving it forward, the wisdom tooth tended to follow along. After about 30 months, we completed the debonding. Of course, let's take a look at number 20. In this case, there was an issue with tooth 27, so it was extracted, and you can see that tooth number 28 moved down nicely and finished well. And then we checked up on the case after a 2-year follow-up. I was concerned about potential alveolar bone loss, but everything progressed well. So, it seems that when you move the 7th molar, the 8th tends to follow along. It's like the child following the father, that kind of mechanism. Not all cases are like that, though. If you look at this case, even though we moved the 7th molar forward in the lower jaw, when we tried to move it, the 30s followed along well. But number 40 had some space and didn't follow as easily. The 7th molar kept moving on its own, and this caused some concerns about retention. We followed up, but there wasn't any specific retention device used. After a follow-up of about 2.5 years, we saw that wisdom tooth followed along for a while but then paused. We had to manually pull it to finish the orthodontic treatment, but overall, it has been maintaining well.
So, we've talked about wisdom teeth today, and it wasn't as sweet content as I thought.
It would have been nice if it went sweetly, but I guess it wasn't all that lighthearted.
Looking back at the past 2 sessions, it seems like we're adding more and more common challenges, starting from implant companies to restorative dentists, oral surgeons, and prosthodontists.
I'm still a long way from being a master orthodontist, but whenever treatments go well, I really feel that sense of fulfillment. If I had known it would turn out like this, I would have just done the implant. There are many cases like that, where the real issue is always the time.
Well, that's all for today. I hope you found it insightful. Everyone, from now on, don't think of wisdom teeth as a nuisance. Let's be a bit more careful and value them.
When it shall be extracted, it must be extracted.
Let's do so, and also when it can be saved or moved. Let's give it a try.
Next time, we'll discuss a bit more the same topic, then we'll move on to another topic.
Well, today's session of sweet and simple orthodontics wasn't easy, but I hope you see it as one of the many options available to us. I hope you can learn about the various mechanic and some diagnosis perspectives here with Ortho Barista. I hope you enjoy your afternoon. Thank you.